All right. Thanks so much, Heather. Welcome, everybody. Happy Wednesday afternoon. We're halfway through the middle of the week, and it is a gorgeous day out in mid-Atlantic Pennsylvania. I'm excited to be here today talking with HR, finance professionals, business owners about the topic of Medicare. I'd really like to make this presentation more interactive. So as Heather mentioned, if you have questions, please put them in the chat. Heather's going to be monitoring the chat and hopefully feeding me these questions in real time, because although I do have a slide presentation on the screen here, I really want to make this hour as worthwhile as possible for you. So I'm happy to go off script and answer questions that are meaningful in your business to help you make this information even more useful. Before I go ahead and get started, just want to bring this up there. I don't think this is a surprise to anybody that the employee population is aging in many of your businesses. You may see more and more employees approaching retirement or age 65. Maybe they're going to work past 65, but there's a lot of information that gets thrown at them right around their 64th birthday when it comes to Medicare. Deadlines, penalties, must enroll. They start to get really nervous and say things like, I know I'm on my group health plan, but I must have to do something because I am being stalked by like hundreds of Medicare people. And some of them even say they're from the government, even though they're probably not. So as an HR professional, they're coming to you because that's where their benefits are. And I know you're wearing enough hats that you don't also want to be a Medicare expert. So that's what we're here to do for you. So as your population starts having more and more questions, feel free to lean on us. I know this is a CE event, so I'm not going to spend much time on our services, but I do want to throw this in there at the beginning of the presentation. I find out when I don't do this, it raises a lot of questions, because what you're going to find in this next hour, we're going to go over a ton of information. And I want you to know that we can be a resource for you to come back and ask your questions as time goes on. So we provide resources to the employers and human resources staff, where we can answer your questions, draft professional responses for you to give back to your employees. We can compare your group health insurance against what Medicare would be for those people that are deciding what to do. And most importantly, a lot of these slides that you're going to see today are part of an employee presentation that we can bring to your company and offer this education to your near retiring employees, or younger if they have questions about family members. And then for the employees themselves, we also provide a service helping them onboard into Medicare, starting as early as when they have those questions, even though thinking they may not retire, taking them all the way through the enrollment process, shopping for secondary coverages and so forth, and then following them for the rest of their life with their questions, renewals, ongoing support. So last two things, and then we're going to move on to the meat and potatoes. What makes us different? Just some things that I want to point out that really do make us unique in the industry. That number one, all of our Medicare advisors are salaried employees. So you're not going to get that hard sales pitch that they are used to getting from all of the influx of mail and phone calls that they're getting. We're really here to counsel them and help them make their best decisions. Nobody gets compensated based on volume of sales or what carriers they go to. And so our only ask is, although we can help everybody nationwide, friends, family, employees, it doesn't matter. When it does come time to enroll, we're hoping that they think of us again and they come back and enroll through us, because that's how we get paid. We get paid through the insurance companies. They don't pay any more for the insurance, but the insurance companies compensate us for our time and help with the client. So thank you for letting me bear with that. Hopefully your biggest takeaway when you go through all of this is if you have additional questions, you know where to go to find the answers. But let's just start from the very beginning. What is Medicare? First, I'm going to kind of give you the overview of what is Medicare, what it costs, what it covers, and then we're going to dive into the HR related questions about the when. When do employees need to make those decisions? What are the big red flags that we should be aware of as professionals to say, hey, maybe you need to talk to somebody before you move forward here. And there was a question that just came in. Yes, the recording of this presentation will be shared, as well as a PDF copy of all of these slides. So you will have all of this information within a day or two after the presentation. So Medicare is the health insurance that becomes available to you, your friends, your family, your employees when they turn 65. So one thing that makes this different and confusing for people is it has nothing to do with normal retirement age. As we know, normal retirement age now is more like 67, 67 and a half, maybe even 68. That has nothing to do with when they become eligible for Medicare. That has to do with when they become eligible for their full Social Security income benefit. But at age 65 is when they have to make a decision. Do I enroll in Medicare like all of the threatening literature says I have to do? Or do I have a valid reason to defer my Medicare to a later date? Now, also individuals that are under 65 may qualify if they're on Social Security disability for at least 2 years, or if they have any kind of permanent kidney issues. Okay, so Medicare in and of itself is quite the alphabet soup. In order to have comprehensive coverage, and this is probably one of the biggest stress points for many employees as they are deciding to retire and roll off of the group health insurance and go into Medicare. There's so many parts and pieces, and there's so much lingo that's being used that they just don't understand. So they don't really know what's needed to have comprehensive health insurance. So when everything's said and done in retirement healthcare, there's going to be 4 parts and pieces: Medicare A and B through the federal government, which is enrolled through Social Security Administration. And then there's going to be some private insurance. Medicare Advantage or Medicare Supplement falls under that C umbrella. And prescription drug plans fall under D, D for drug. So these can be enrolled in either directly through the carrier or through an insurance agency, hopefully HTA. Regardless of what you choose on your secondary insurance, you still have to have both Medicare A and B. And we're going to talk about that a little bit more because we're going to talk about things like COBRA, retiree, severance coverage later, and how that coordinates with Medicare. Okay, so I'm going to blow through these super quick on the coverages because I'm sure you guys want to get to the bigger questions, the more complicated questions. But if you want some additional explanation on these, just speak up in the chat and I'll be sure to elaborate. I think of Medicare Part A for admission, that's your inpatient coverage, and there's no cost for Medicare Part A. You get that because you or your spouse has worked at least 10 years and paid Medicare taxes. Medicare Part B, that's everything that you're not admitted into the hospital for. So outpatient services, doctors, specialists, labs, x-rays, surgeries, chemo, ER, even things that you go to the hospital for, like the emergency room. And if you're in the hospital under observation, all of that's outpatient. So easy to remember: A, inpatient; B, outpatient. A has no cost, but B does have a cost. And that cost is based on income. So I want to spend just a couple minutes on this slide here because I find this to be of interest, especially if you're tasked with handling some of the C-suite employees, because they tend to fall under a higher income bracket. So a couple things I want to touch on here. The base income bracket for deciding Medicare premium is up to $103,000 for individuals, or if they file their tax return jointly, up to $206,000 for the household. They will pay the 2024 Part B Medicare premium. This is adjusted annually, of $174.70 per month per person. Each spouse is going to pay the same premium. If there's a higher income bracket, then you will pay more for the Medicare Part B premium. So let's say we fall in here in this income bracket. So households under 500,000, and I'm sorry, individuals under 500,000, households under 750,000 in this range right here, 380 to 750. You can see that the Medicare Part B premium is considerably higher. So for those people that are earning higher wages, have income from other sources, maybe have a K-1 push through if they're part of a business ownership, they're likely to pay more for the Medicare. So again, I just want to remind you that this is going to be the same premium for both spouses. So if you have an executive and a stay-at-home spouse with that executive, even that stay-at-home spouse is going to be rated based on the household income for the two of them. Also, one thing that I want to point out is this is rated based on your income 2 years ago. So you have a high wage earner in your office who's earning a good living, getting ready to retire and go into Medicare, and their income's going to drop because no longer going to be collecting a salary. So the question is, am I always going to be stuck paying this higher Part B premium even though my income was only higher in my working years? Now that I'm not working anymore, my take home is not as high. And the answer is no, they're not going to be stuck with that higher premium for life. So a couple things that we do, if somebody were to call into our office and we ask them generically what income bracket they think they might fall in. If they fall into one of these higher income brackets, the conversation is, how do you anticipate your income to change in retirement? How soon do you expect that to happen? And we talk them through the quote unquote appeals process. And I don't want to scare you with the appeals process. It's a form they fill out that says, this was my income last year. This is what I expect my income to be because I have a life event of retirement or work reduction. And here's what I expect my income to be in the future. And more than likely, the Social Security Administration takes them on their word, reduces their Medicare premium accordingly. If for some reason they went outside and got outside counsel or just enrolled in Medicare on their own and didn't know about the appeals process, eventually Social Security would figure out that their income has gone down. Every year, this amount is audited in December for the following January premium. So, for example, if somebody retired in 2024, this year their Medicare premium is based on their 2022 income. But 2 years from now in 2026, it's going to be based on that 2024 retirement income that has been reduced. So long story short, eventually Medicare will figure out and Medicare premiums will go down over time, but more than likely it's going to make sense to just file that appeal form. It takes about 5 minutes to complete the application and send it in. So this is always really good information for your C-suite folks that are probably coming in at this higher income bracket. Okay, so Medicare A and B in and of itself is not enough coverage. You can see here on the screen the out-of-pocket expenses if you were to have Medicare only. Inpatient deductible per admission, $1,632. There could be daily copays if you're there for a long time. Outpatient services, check out this deductible, $250. That's pretty good when you're comparing it against health insurance, group health insurance. So $250 annual deductible for outpatient and then 20% coinsurance. Doesn't sound so bad. The problem is in the out-of-pocket maximum. Medicare has no cap on out-of-pocket maximum like group health insurance does. So you're going to be paying 20% of that $100 doctor visit, but you're also going to be paying 20% of that $100,000 observation bill or the $70,000 chemotherapy bill. And that never caps out for you. And that's why secondary insurance is recommended. Medicare also does not cover things like dental, vision, hearing aids, long-term care, personal needs, help with assisted living, or home health care aids in many situations, and also more holistic approaches to care. They just haven't got on that bandwagon yet for the holistic approaches. Although, heard the coolest thing the other day, my mom, who doesn't even appear to me to be overweight, she qualified for Medicare for free nutrition counseling, and she got this whole weight loss program and meal preparation and everything else. And my mom has lost 30 pounds in the past couple months. So I was like super excited to see that Medicare was actually being proactive with weight loss systems. I think she said the requirement was your BMI has to be above 29% to qualify. So not too difficult of a qualification, unfortunately, or fortunately, however you want to look at it. Okay, so let's talk about the secondary insurance real quick, and then we'll move on to enrollment timing. So like I said, there's two ways to do secondary insurance. Part C, technically speaking, is what's called a Medicare Advantage plan. It replaces your Medicare A and B, or you can do what's called Medigap, otherwise known as Medicare Supplement, which sits on top of Medicare A and B. So one replaces A and B, and one sits on top of A and B. But guess what? No matter which one you choose, you still have to pay that Part B premium. So sometimes people in that higher income bracket say, I could get away from that higher premium by going with an Advantage because it's going to replace that. That's not true. You still have to pay that Part B premium. The Social Security Administration wants their money, no matter what secondary insurance you choose. So I'm just going to go real high level. And I think the purpose of this is so you can get a better feel for how this stacks up against group health insurance, because I've heard from many people that one of the main reasons why they don't enroll is because they're nervous about what's to come with their healthcare expenses. They've heard that healthcare can be very expensive in retirement years, and they're comfortable sitting on this group health plan now, and it's more the unknown that scares them. And once they actually understand how Medicare works, they feel much more comfortable and decide, okay, now it's time to actually retire because I'm feeling comfortable with this. So there's two ways to do it. Medicare Advantage is going to look and feel more like probably what they're used to in a group health plan. It might have some dental, vision, hearing built into it, maybe some free gym memberships, over-the-counter benefits. So they throw in all these neat bells and whistles. But at the core of the plan, it's a managed care plan. So there's going to be networks, PPOs, HMOs. There's going to be managed care, which is going to be prior authorizations, pre-approvals, things like that. So more managed care from the insurance company. But in exchange for that, you're not going to pay very much for the coverage. So that Medicare Part B that you pay for, that in many cases may be the only premium you pay, because you could get a lot of Medicare Advantage plans, and quite honestly, some really decent ones with like a $5 doctor copay, a $10 specialist copay for as little as $0 per month premium. So if they're looking for low premiums, Medicare Advantage is the way to go. There are higher out-of-pocket expenses because just like group insurance, they're going to pay copays for all their services. Doctors, specialists, surgery, chemo, everything's going to have some kind of associated copay with it until you reach your out-of-pocket maximum somewhere in the ballpark of $8,000, $8,500. I'm going to flip down here to the Medicare supplement side. This is the one that actually sits on top of Medicare A and B. It doesn't replace it. This, in many cases, is actually better coverage than what people are used to on group health insurance, believe it or not. Number one, I'm going to skip right over here to this third column. It's not managed care. There's no network restrictions. You can go to any doctor nationwide that accepts Medicare, which is about 99% of non-pediatric doctors across the United States. So very large access to providers and no managed care. So you're not going to be messing with the prior authorizations and an insurance company deciding how important this service model or this service is comparative to your age and how much they expect you to recover and your lifestyle and quality of living after you do require. Those are the types of things that managed care companies look at when you're in retirement. So full freedom here doesn't necessarily come with all the bells and whistles, the dental, vision, hearing, but we can certainly add them on for an additional cost. So the main downside of these Medicare supplements is that they do have a slightly higher premium, another $100 to $250 on top of your Medicare. But in addition to real flexibility in getting your care, little to no out-of-pocket costs. Believe it or not, and my mom said if she knew how good Medicare was going to be for her, because she has a lot of medical conditions. She had polio when she was a baby, and she has a lot of complications with that as a retiree now. If she knew how little out of pocket she would spend on healthcare and Medicare with a Medicare supplement, she would have retired much earlier than she did. Maximum out of pocket $240, then 100% coverage thereafter in most situations, depending on what plan they choose. But in most situations, max out of pocket of $240 a year. So you can have a plan that looks and feels more like group health insurance. Managed care may be a bit of a concern in retirement years for some people, because that's when historically people need most of their health care. but they have this other option here, Medicare Supplement. You pay a little bit more, but more flexible coverage and much lower out-of-pocket expense. I have a question here. What are the network limitations for Advantage plans? Does it vary by state location? Yes, I will explain that. Can you address military retirees or retirees and spouses? Yes, I will address the military, but can we address that when we talk about COBRA retiree and severance coverage? Because military retirees fall very close to regular retiree coverage. So as far as network limitations go, I'll answer that one now. The networks are, so you probably are dealing with benefits. So just think Aetna, United Healthcare, Cigna. You have very broad networks in the group health insurance market. When you get to the Medicare networks, they can be more restrictive. Many of them can be locally or regionally based. So if we have somebody who travels, we want to look for a plan that has a travel network. Also, the networks can be much slimmer. So if I looked at Aetna Group Health Insurance, and I'm just using them as an example, I'm not saying they're good or bad, but if I look at any company group health insurance, let's say Aetna, and then I look at Aetna Medicare Advantage, the Medicare Advantage network is going to be slimmer than the group health network because the reimbursement rates on Medicare are likely lower. And so not as many doctors participate in the Medicare Advantage networks as they would in a regular commercial group health plan network. I hope that answered your question. If not, let me know and I'll dive more in detail. Last question that I tend to get from many people, or we tend to get from many people, is, hey, I love this idea of having no additional premium, and I'm pretty healthy right now, so the co-pays and the managed care don't bother me too much. Can I go with this Medicare Advantage option now and then switch over to supplements when my out-of-pocket expenses start to get high because I want the more flexibility and the lower reimbursement rate? And the answer is that may not be as easy as you would think. Because when you first become eligible for Medicare, meaning when you first turn 65 or come off of your group health plan, you get access to anything you want, no questions asked. But after that, the only way to get into this program is to answer medical questions. So the program that's going to pay more for your medical care, have less out of pocket and less restrictions, is going to require medical underwriting after your first 6 months. So it's important that when people pick out their health care, they sit down and talk to somebody, because although this is not a permanent decision you need to make, you won't have as many options as you do when you first go into Medicare. So it's important to give it consideration at that time. Okay, touch on the Part D, which is the last to round out that alphabet soup, A, B, C, D. You're going to need drug benefits with anything that you do. It's not part of the base Medicare program. If you get a Medicare Advantage plan, the Part D is included in the Medicare Advantage plan. If you get a Medicare supplement plan, this is a la carte. You just add another drug plan. So everything you pick what you need and you just add it to the plan. In order to shop prescription plans, we do look at the list of prescriptions that people are taking because that's really important. Every prescription plan is going to cover prescriptions in every category. So you will have a choice of prescriptions for every ailment out there, but they don't cover every prescription in every category. So making sure that the ones that you're currently taking are covered is a very good practice, and we will do that, and also check to make sure that the pharmacy that you're using is one that's a preferred pharmacy on the plan. The good news with these plans is we can reshop prescription plans each and every year during the annual enrollment period. So if they change prescriptions throughout the year, we'll always be able to reassess for them. And this is a VIP service that we offer to our clients, helping them reshop each and every year.
Hey, Tracy, we have one more question back on the Advantage. Can you provide on average the percent of retirees electing for Advantage and those electing for supplemental?
Yes, I can give you round numbers based on industry statistics. Currently, it's about 30 to 40% of people are choosing Advantage over supplemental plans. However, if you go into a more urban area, possibly middle and lower middle income, you'll see that percentage of Medicare Advantage skyrocket because the lower premiums on Medicare Advantage are very attractive to people that may have premium affordability issues. We're still finding that the people that can afford the premiums like the idea of the security and flexibility of the Medicare supplement plan. So middle, upper middle, and higher wage earners are primarily still picking supplemental plans. Not all the time, but that just seems to be the average. Okay, so Part D, you may have heard the term. So I used to say this and everybody knew what I was talking about, but they've kind of phased out this terminology. Donut hole. So I don't know if the word donut hole means anything to you besides my son's birthday's today. We're getting donut holes for dinner tonight because what better to have for dinner than a box of Dunkin' Donuts donut holes. But the donut hole when it comes to prescription drug plans with Medicare is now called a coverage gap. So if you haven't heard that term, they're kind of phasing it out. It got a bad rap. So the federal government decided we're not going to use that term anymore. We're going to call it a coverage gap. Bottom line of this confusing screen here is your prescription costs. When you enroll in a prescription drug plan through Medicare, your prescription costs vary throughout the year. So it's a little bit different than group health insurance. There's not as much certainty there as to what you're going to pay when you go to the pharmacy, because you may start out in a deductible where you're paying the full cost of your drugs. Not all plans have a deductible. Many plans waive deductibles on generics, but it could have a deductible. Then when you satisfy your deductible, you're going to go into your copay or your before gap stage where you're going to pay copays or a percentage of cost for your prescriptions. Probably looks and feels more like a group health plan. And then when your retail prescription costs, not what you're paying, but the full cost of your drugs reaches $5,030 up to $8,000, you're going to pay a 25% coinsurance. And then after 8,000, you're going to pay 0% coinsurance. Super silly and confusing, unnecessarily confusing for these poor seniors. However, what we can do is we can do a report through our system. It can also be done on Medicare.gov if somebody wants to go and do it themselves. But we have a proprietary system that we use that does a report that says, based on your prescriptions, here's what it's going to cost you in January, February, March, April. It goes through the whole year, tells you when and if you're going to flow through these stages and what you can anticipate for your full out-of-pocket costs for the year. Biggest takeaway on Medicare drug plans is they are getting better and better every year. The government with the Inflation Reduction Act has put some restrictions on. This year, 2024, they introduced this stop loss where if your retail cost of your prescriptions exceeds $8,000, you're capped out after that. They're actually going to make that a true out-of-pocket by 2026, they're making it a true out-of-pocket maximum of $2,000 for individuals. So in the past, I used to have to talk to people about $5,000, $8,000, $10,000 of out-of-pocket prescription expenses in Medicare if they were on a major prescription. And now I'm not having to have those hard conversations any longer. So this is really good news. It's a good direction. I do see another question here. Are the supplemental plans in danger? I'm aware of initiatives to push people into the Advantage plan. So you're exactly right. There are major initiatives to push people into the Advantage plans. And I'm going to give you, that's a great question. And from one professional to another, I'm going to give you a little bit of lowdown on that. The way Medicare Advantage plans work is, yes, we still have to pay our Part B premium to the federal government. But the federal government pays the Advantage companies to take you as the patient off of their financial responsibilities. So it may look something like this. I pay $175 a month to the federal government for my Medicare Part B. The federal government may pay, I'm just saying Aetna, not naming any insurance company names, just for example purposes, may give Aetna $1,000 a month on my behalf. And now Aetna is my insurance company and they're responsible for managing my care and paying all my bills. Aetna cannot go back to the federal government and say, Tracy cost me $5 million this year. You need to give me more money. So the federal government has now just capped their loss on you at $12,000 a year. It's a much lower risk for the federal government than a Medicare supplement plan, because on a Medicare supplement plan, you give your Part B premium to the federal government, you buy your supplement to pick up those out-of-pocket costs. But at the end of the day, the federal government in that instance is responsible for paying 80% of your medical bills. The supplement pays the other 20%. So the federal government has a much higher and unknown risk if you're on a supplement plan and they didn't push you off to the Advantage company. So yes, there are lots of initiatives. It was not named Medicare Advantage by mistake. It was named Medicare Advantage to make a point and to be attractive to people. Supplemental plans at this point, as far as my understanding and research knowledge has, industry research has been, is that they're not in danger. If anything happens to them, more than likely what we're going to see is they will grandfather the people that have them, and they may start forcing new people into the Advantage market. Right now, they're still giving you the freedom of choice, but adding in all these bells and whistles to Advantage plans to really get people to make a much more serious look at them. So I hope that answered your question. All right. Just like we pay more for Part B if we have a higher income, we also pay more for Part D if we have a higher income. You can see here, in addition to the insurance company premium for your drug plan, you would pay a monthly surcharge directly to the federal government if you were at a higher income for that as well. Premiums for drug plans can be cheap. We have one this year that we sold, I think it was 50 cents a month. The WellCare plan was 50 cents a month. We sold thousands and thousands of them. And believe it or not, it was a really decent looking plan for many people on lots and lots of different drugs. So premiums are not high, but you would pay an extra surcharge if you're at a higher income. Okay, so just to give you a feel, if you're comparing against group health insurance, or if somebody's thinking about what do I need to budget for in retirement for healthcare premiums, we can see here Medicare Part A costs nothing. Base income bracket Part B is about $175. They can do the supplement route. Here's some sample premiums here, or they can do the Advantage route. More than likely doesn't cost them any extra money. And you can see the bottom line here, what it would be per person per month, all in A, B, C, and D of Medicare, depending on if they chose a supplement or an Advantage. You can estimate about $100 more per person per month for each income bracket that you go up. So the highest wage earners, you can see the Part B went up. We now have an income surcharge. None of this changes in the middle here, but you can see how that impacts the bottom line, those income surcharges that they get. So we're looking at $675 to about $900 for a C-suite executive level salary wage earner going into retirement. Okay, so thank you for sitting through that. I hope you learned a little bit more about the Medicare system. Gives you a little bit of a comfort zone when somebody is saying, hey, I'm really scared to retire because I don't know what Medicare is. You can say, hey, there's some pretty decent options out there for you. It might make sense for you to explore this a little bit further. It doesn't have to be scary. Can you use your HSA to pay Medicare premiums? Fantastic question. And yes, there's a whole section on HSA here. So we'll talk about that in just a minute. Thank you. Okay, so let's compare, because we know when somebody turns 65, they have access to Medicare at that point. So just because they're going to continue to work and they continue to have access to your group health insurance doesn't mean that they can't voluntarily choose that Medicare might be better for them. So who's going to make that decision? Number one, we first need to know, and I'm sure all of you are probably aware of this, that you don't have to take Medicare at 65 if you have credible coverage. Credible coverage has two requirements: group health insurance based on current active employment. So that's the current active employment of the primary insurance holder. So if I'm the insurance holder and I'm employed through my company with benefits, my spouse, my dependent would also have credible coverage because I'm the employee who's currently actively employed and we both have that group health coverage. So what's not credible? ACI Obamacare, if you have anybody who's retiring prior to 65 and needs to go on their own plan, or group plans that are not based on active employment. COBRA, retiree, severance coverage, and we'll also talk about the military retiree benefits when we get to that section. Okay, so let's assume most of your employees are on credible coverage. They're still working. They have your group plan or their spouse is on your group plan. When do they have to enroll? They can enroll anytime after age 65, provided they're holding that credible coverage. They have up to 8 months after credible coverage ends, meaning their group coverage ends or their employment ends. COBRA is excluded as credible coverage because it is not based on active employment. So once you're on COBRA, you're electing COBRA because you're no longer actively employed at the company. And in order to be credible coverage, it has to have 2 requirements: group health insurance, which COBRA certainly is, but also that you are still working at the company that's offering that insurance, which at that point you no longer are. And I'm going to go into some COBRA best practices in just a moment. Okay, so they have 8 months to get on the coverage, valid times to waive off. They can waive off when they turn 65, even if they're going to keep working. That would be considered a life event for any group health insurance plan. They can waive off during their medical open enrollments. They can opt out. Of course, retirement, that's when they're going to want to get off. But for most of your group health plans, they probably can waive off anytime they want to after 65 if you consider, quote unquote, enrollment in Medicare as a valid reason to opt out. If that's not in your opt-out, I would check with your plan administrator. I would strongly encourage it because people choose to opt out when they have big medical expenses coming and they find out that they can get on Medicare for a $240 deductible than 100% coverage. So that's in the company's best interest to allow people to waive off anytime they want after age 65 by virtue of enrolling in Medicare.
Tracy, we have another question. What about someone that is turning 65 and also going on long-term disability at the same time? And then they put in parentheses because of cancer diagnosis.
So that one, that would probably be a one-off that we would want to go back and ask some questions to the insurance company on to see if they are going to keep them covered as an active employment status on the group health insurance plan. If they're going to move them into a non-active employment status, that actually changes the group health insurance to secondary over Medicare. So that's really going to depend on how soon the group health insurance provider is going to need to recategorize them as a non-active employee. And I do have some of those questions drawn up, but if we want to go more in detail on that, I would prefer to have that as a one-off conversation so we can get to the bottom of some detailed questions there. Somebody just volunteered. Normally, group health insurance remains in effect for at least 1 year while on long-term disability. Yes, that is true. You can keep the group health insurance. I, again, would just want to make sure that they're keeping that employee as an active employee. And maybe the formal is 1 year. We did have an executive one time. Of course, all these things always happen to, you know, your main C-suite people. He had cancer and he was on long-term disability. He remained on the group health plan. The group health plan continued to pay his claims. He went through his first surgery. They paid for his surgery claim. He had his next surgery scheduled and they said, we just did an audit on your account and found out that you've been on disability and are no longer actively employed at the company. So yes, we will keep you on this group health insurance plan, but we will move to a secondary payer position. You need Medicare as your primary payer for this upcoming surgery that you have. Unfortunately for him, his surgery was scheduled, I don't know, say the 17th of the month. This was the 14th of the month when he found this out. The soonest he was able to enroll in Medicare Part B as his primary was for the first of the following month. Fortunately, he was in a financial situation where he went forward with the surgery because of the cancer diagnosis. That was more important to him than worrying about the insurance. However, many employees probably financially would have to be making a decision then. Do I postpone the surgery until I could get my Part B in place? Or do I have the surgery and pay for it out of pocket because my group health insurance is now paying secondary? Can someone have both Medicare and be on a group health plan at the employer? If so, which would be primary? So yes, they can do that. The group health plan, you can't have a group health plan and have either a Medicare Advantage or supplement. So we're just talking Medicare A and B right now. If somebody has Medicare A and B and a group health plan and they're still actively employed, if the employer has more than 20 employees, which I assume most of you do, that group health plan remains primary. That's why most people don't enroll in Medicare Part B until they retire, because it sits secondary to their group health plan. Why pay that $175 a month? If the company has less than 20 employees, Medicare is primary. Therefore, Medicare is very necessary if they're going to stay on the group health plan after 65. But I presume most of you in this Zoom room do not have companies less than 20 employees. If an employee turns 65, still works, and does not elect Medicare until they retire, does the 6 months start for them at the time they elect Medicare coverage? Okay, so I believe the 6 month question is the 6 months to get one of those Medicare supplement plans without medical questions. That 6 month countdown starts on the effective date of their Part B. So if I retire today and my Part B goes into effect June 1st, because let's say I'm covered on my group health benefits through the end of this month. My Part B starts June 1st. I have until December 1st to make a decision on a supplement without having medical questions. After that, I would have to answer medical questions. I think I covered all the medical questions, all the questions in the chat there. I'm going to keep moving forward. If somebody enrolls after age 65, this is the form that they're going to need to get them in the door to Medicare. It says the dates that they were working and the dates they had the group health plan. So again, the dates that they were actively employed at the company goes into that. That's why COBRA wouldn't qualify them as credible coverage, because they would see the date that they stopped working here. All right, so we know an employee doesn't have to come off the group health plan if they're going to keep working past 65, but there's some reasons why they may want to. You cannot force them off the group health plan as their employer, but by bringing them education, they may find that Medicare might be better for them, and that's certainly their option. What could be a win-win out of that? The employer could save money on the group health plan premium if they decide to go on Medicare. We know that that population of employees tend to be the highest claims population. So it could be a possible reduction in your claims exposure, therefore helping with renewal increases in the future. And it could help get the employee on a plan that may have lower out-of-pocket expenses. The employee wins, possible save money on premium depending on the circumstances, possible lower out-of-pocket risk if on a supplement, and possibly a broader network, again, if on a supplement. Here's the break even. If employees are paying less than $3,600 a year while working on their group health plan, I'm not just talking premiums, payroll deduction. I'm talking premiums and out-of-pocket expenses. If they're less than $3,600 a year, group health plan's more cost effective. That's where they're going to stay. If they're more than $3,600 a year, Medicare probably is more cost effective. It's worth looking at in more detail. So again, those people that are getting ready to have a big claim and maybe they have an HSA and a large deductible, Medicare might look attractive to them because where they otherwise weren't hitting their max out of pocket, now they are, and now their out of pocket expenses have surpassed this break even. Okay. So now let's touch on the red flags. We have about 15 minutes left. I love that you guys have the questions as we are going along. Let me make sure I got them all. Okay. Wait, hang on. Have always been advised that there is more exposure, which means cost to the member under Advantage versus the supplemental. Kathy, I would agree with that. Thank you. One of our soon retiring employees said that he would try to get his Part B premiums lowered by showing his retirement is a life event that changed his income. Is this possible? Absolutely. Would a decrease in income retirement override to your look back determine the premiums? Okay, so if he files the appeal to get his premiums lowered, they are going to take his word for it. So if he says, my income went down to, I'm making this up, $100,000. Now that's what it's going to be for this year because I've retired. Medicare or Social Security is going to take his word for it and they're going to reduce him to the base level and just charge him that 175. But 2 years from now, when they actually do the audit on this year, if they find out that he really made 500,000, they're going to come back and say, hey, you underpaid for this year. You owe us, I don't know what whatever the difference is, $3,600 in a lump sum payment for what you underpaid in 2024. Guess what though? If you overpay and he didn't file that appeal and he just paid for it, they're not going to come back to him in 2 years and say, hey, you overpaid. Let me give you your money back. So always file the appeal. Like I said, it takes 5 minutes to fill out the form. You send it in within 60 days. They tell you if you're approved 9 out of 10 times. If you've had a retirement, probably 99 out of 100 times. If you've had a retirement, they're going to reduce it. All right, red flags, COBRA, severance, HSAs. These are the biggest red flags for employers. And if we don't get through this in as much detail as you want, feel free to reach out individually and I can go through this with you. So we know that we can defer Medicare when they turn 65 because they have credible coverage. A lot of people are told they cannot defer Part A. That is absolutely untrue. Think of it this way. Part A costs $0. 20% penalty on $0 is still $0. They don't have to worry about that. However, having said that, we always recommend, because Medicare Part A is free, just enroll when you turn 65. You go online, it's done. It's super easy. It's not going to cost them anything. And guess what that does? That assigns them a Medicare number. So if they have a quick retirement later, a quick exit, they can pop on the Part B and get their supplement and be done with it. Sometimes it takes up to 5 weeks to get a Medicare number assigned. So if they wait till retirement to apply for Part A and B together, sometimes we're finding that it doesn't get processed, especially if they're applying for January 1st, because that time of year, Social Security is super backed up and things move really, really slow. So we almost always recommend people apply for Part A when they turn 65 and then hold off to do the rest later, except if they are electing or they're in an HSA plan. Because once you apply for Part A, even though it's free, even though you're not using it, it disqualifies you from making future deposits into a health savings account. Doesn't disqualify from using those deposits. You cannot deposit, but yes, you can use the funds to pay for anything that is a federal government program. Medicare A, which has $0. Medicare B premiums can be paid for with an HSA. If they do a Medicare Advantage and that has a premium, Medicare Part D drug can be used to pay out of HSA and any out-of-pocket expenses. The only thing they cannot use an HSA to pay for is their supplement, because it's a private secondary insurance. Surely wish my HR department had known having Part A prevents me from having an HSA account. I enrolled at 65. Yes, unfortunately, we hear that story all the time. We have people call us at 69 and say that they've had Part A for 4 years and also have been contributing to an HSA. And I say, fingers crossed, you don't get audited, because then they'll just have you pay back the taxes, interest, and penalties on those tax-free deposits. My employee tells me he would not be able to enroll in Part A for 6 months after his HSA deduction. Is this correct? Okay, great lead in. 6-month backdating rule. Thank you for that cue up there. So what happens is that's kind of the rule. So what happens is when you enroll in Medicare after age 65, they always backdate your Part A 6 months. No sooner than your 65th birthday, But if you're well over 65, you're going to have your Part A backdated 6 months, which means that proper planning going into retirement is important because we want to make sure your HSA deposits don't exceed too much in the year that you're going to be enrolling. It's not that they have to wait 6 months from the last deposit. Let's say you have somebody who's a smart financial person and says, okay, I'm going to enroll in Medicare in August. So I'm going to make my full HSA deposit in January this year, wait the 6 months, and then enroll in Medicare. That's not going to work. What happens is when they enroll in August, they're going to backdate it 6 months, which would be February 1. And then they're going to say, you can only make a prorated deposit for this year of 1/12 of the HSA maximum because you were only not enrolled in Part A for 1 out of 12 months of the year. So it's not a 6-month time frame. It's that they backdate it 6 months and they use that number to calculate the prorated deposit amount. So I hope that made sense. If you offer HSAs in your office and you want to do a more in-depth on HSA, I'm happy to do that with you. All right, so credible coverage, primary actively working, group coverage. If they're over 20 employees, no issues. If they have less than 20 employees, you may still need Medicare A and B for primary. And if you fall in any of these situations, you do not have credible coverage and you must have at minimum Medicare A and B because that's going to be your primary insurance. All right, so let's talk about COBRA. If a lot of people go on COBRA at 65 because they say, well, I have a spouse that's 64. I'm just going to take COBRA until he or she is eligible, and then we'll both go on Medicare together. Well, did you know, and I'm sure most of you do, that if a retiring employee goes on Medicare, that could actually extend COBRA for their dependent spouses to stay on COBRA. So Medicare typically is more cost effective than COBRA, especially because they're going to need Medicare A and B anyway as the primary insurance. So why not do the supplement and let the dependents stay on the COBRA? The retiree coverage, if they have access to an employer retiree plan that's being sponsored by the employer or a military retiree plan, all they need to do is sign up for the federal government A and B. That's going to sit in the secondary position. And that retiree plan, I'm sorry, A and B is going to sit in the primary position. And the retiree plan, whether that's military or private employer, is going to sit in the secondary position. Severance. This is an interesting one because, again, you want to be nice as the employer and offer them a package. I'm going to pay for your benefits, keep you on the group health insurance for the next year. It sounds fantastic, but they need to add Medicare A and B to that. So even though you're offering them these benefits, they're still taking on the full cost of A and B. So they have an additional cost. It may make more sense to just give them whatever money you would pay on those benefits and let them go into Medicare right away. Let me show you some examples on that.
Also, Tracy,
Oops.
we have a question. Does K1 income count towards premium increase?
It does. So premium increase is going to be based on your modified adjusted gross income. So basically, I tell people, look at the bottom of the first page of their tax return, all your incomes added up. There might be a couple add backs. I'm not an accountant, although I could give you the bullet points of what's added back in on that. But yes, generally any income is included in that. Oh, yep, perfect. Okay, so COBRA, retiree, or severance. So these are all things where Medicare's more than likely going to be listed as primary. Now, the interesting thing is how soon does the underlying COBRA retiree, because it's sectioned as retiree, they know they're secondary. But COBRA and severance, it may take, because it is just your group insurance, you're still just paying for it for the employees. It may take the group health insurance company a little while to figure out that this is no longer active employment and move into a secondary payer position. But like I said with my example earlier, when that typically gets discovered is when large claims start happening and the insurance company goes, huh, This person's over 65. Is there anything we can do to lower our risk here? And they sure enough discover this employee's not currently actively employed. We're not even supposed to be primary. We're pulling our cord right here and telling them that so we don't have any more risk. So unfortunately, it comes at a bad time. So we try to counsel people. This is a copy of our webpage that we would send out to people that are on one of these types of coverages. We have questions. We'll communicate with the employer or advise the employee to go back and ask HR or check with the plan administrator to see, number one, will you remain the primary payer for this person? If so, we have a little squirm room in the Medicare enrollment. If not, then we need to enroll in Medicare A and B right away. Because remember, even if Cobra or Severance says, yes, absolutely, we'll pay primary, and for some strange reason, the insurance company is even willing to put that in writing to you, Medicare still has a rule that once they're no longer actively employed, if they don't enroll in Part B in the first 8 months of not being actively employed, then they're locked out for a certain period of time. So we still have deadline restrictions that we need to look at, even if Cobra or Severance agrees to pay primary. So timing considerations need to be done here. I would just say, as a point of reference from an HR perspective, if you have somebody who's approaching 65 or over 65 that is planning on going on Cobra, or you're offering Cobra or Severance to, recommend they talk to a Medicare professional about that. We would love to be your people, but any Medicare professional to make sure they're doing it right and not going to get themselves in a tough situation later. All right, so this is my last slide. We're going to wrap it up here in 1 minute. So Heather can tell you about your CE credits, but here's just an example of a severance win-win. So let's say you were going to offer severance to a retiring employee. You're agreeing to pay their group health insurance for them. I don't know what your health insurance premiums are, but mine are absolutely ridiculous. So I'm paying $900 to $1,500 per month for a single in that age range. Plus, that retiree still needs to add the Part A and B at minimum. So it's going to cost that retiree, $175 to over $500 a month, depending on their income. So they have a cost and you have a cost. What if you just said, instead of paying this to the group health insurance, I'll give this to you as a stipend, or maybe just a one-time cash payout for a year of premiums or whatever it might be. You use that to buy your Medicare. Now this money can fund 100% of your Medicare. I've reduced my exposure as the employer because instead of paying the full cost, I've capped it at XYZ numbers, and I've reduced your exposure as the retiring employee because the money I'm giving you will help pay your Medicare premiums that you need anyway. So just an idea. We're happy to talk through it on a one-on-one basis.